Welcome. Today we are going to look at epistaxis. Signs and symptoms. Nursing diagnosis for epistaxis. Epistaxis is bleeding from the nose. It's caused by rupture of the blood vessels inside the nose. Let's look at the signs and symptoms of epistaxis. These may be sudden, mild, moderate, or severe. Visible blood from the nose. Headache, flushed face, and anxiety. Features of shock, depending on the blood loss. Oral pharynx bleeding in case the bleeding spot is posterior. Pallor, restlessness. Those are the signs and symptoms we are going to use for making our nursing diagnosis. So, let's look at how we can formulate the nursing diagnosis for epistaxis. We are going to formulate both actual and potential nursing diagnosis. Below are some of the nursing's diagnoses formulated. Ineffective airway clearance related to airway obstruction by blood, as evidenced by dyspnea. Fluid volume deficit related to severe bleeding as evidenced by pale mucous membrane. Acute pain related to inflammatory reaction in nasal cavity as evidenced by patient's facial expression. Acute pain related to inflammatory reaction in nasal cavity as evidenced by patient verbalized pain. Knowledge deficit related to lack of information on epistaxis as evidence by patient asking many questions. Anxiety related to loss of blood as evidence by patient verbalizing much blood loss. Impaired social interaction related to fear of blood as evidence by people distending themselves from the patient. Risk for infection related to nasal trauma. Risk for anemia related to severe blood loss. Please subscribe for more.